Orthodontic treatment is a treatment which orthodontic force is applied to 28 teeth to move it to the plane position. The key is to find the fastest and most efficient device to achieve the aesthetic treatment without pain or side effects. With the trend of growing adult patients, aesthetic orthodontic devices will achieve the mainstream. Despite the numerous advantages of clear aligner, it is not used popularly due to the limited abilities. The clear aligner will have more capacity if it can move the teeth as intended by a dentist. Doctors weren't able to achieve the desired result with the clear aligners before. Clear aligners weren't efficient enough, which many patients ended up with conventional bracket treatment or laminate. Main reason why the clear aligner did not achieve the desired effect is that because the clear aligners spend more time in the patient's pocket more than staying in the mouth. Orthodontic appliance should not cause pain and can be applied easily. However, the conventional clear aligners is fabricated in moved setup position, cause too much pain and lost its strength way too quickly. Using the analogy of a car corresponds to the teeth. In order to move this, it requires the use of the steering wheel and the engine. Transparent orthodontic device represents the steering wheel, power button represents the engine. Previously, plastic device performed the role of the steering wheel and the engine simultaneously, which had many limitations to perform its task. Conventional clear aligners were not able to apply constant force to align the teeth. So many clinicians have negative thoughts about the transparent orthodontic device because of its limitations. Thus, we have developed power buttons that stays in attachment bonded to the aligner, which is a newer version of a clear aligner that stays in attachment bonded to the teeth. The power button is made of a high modulus of elastic material, which has a proper strength to resist deformation while having a constant elasticity. As soon as patients wear the device, orthodontic force is exerted immediately. Power button is highly elastic product which creates enough force to act as a capillary pressure. One of the advantages of the power button is that it can be attached to the aligner in various bucco-lingual directions. Thus, orthodontic force can exert on teeth in any direction, even without special skills. Any dentist can easily use this product because it is very easy to make and there is no special laboratory procedures needed. Most importantly, it is very inexpensive. Power button has concave and convex form and three types of resiliency: high, medium, and low level. To use a power buttons, the dentist needs to make points on the area where dentists want to move the teeth, which is fabricated in the laboratory. Place a hole with the hole puncher. Select the appropriate shape of the power button. Place on clear aligner and fix with bond with proper direction. Choosing the appropriate model from the power button library is the most important step. Target tooth movement is a treatment which moves only the targeted teeth. It is known to be a very difficult treatment, but with the invention of the power aligner, it is no longer impossible. Orthodontic treatment with an arch wire is an extremely difficult treatment because it forces pressure on all 14 teeth. It creates unwanted teeth movement, which makes the treatment difficult. If you look at this picture, you can see that only unwanted teeth were moving into the unwanted directions instead of the wanted lateral incisor teeth. Comparison between traditional invisible orthodontic device and power aligner. Existing invisible orthodontic treatment initiates its treatment only on a small portion of the teeth. At the end of the treatment, the aligner gets in contact with the wire region. A lot of patients feel severe pain and uncomfortableness, which is why they often put away their aligner into the pocket. On the other hand, PowerLiner blocks out space area of tooth movement while minimizing the setup space on laboratory procedure. It means that the device is comfortable and it does not cause pain on the patient. It means that the patients are likely to keep the device in the mouth for a longer time. Because tooth movement occurs by the elasticity of the power button, dentists do not have to worry about whether or not tooth movement will occur. Transparent orthodontic device mainly serves as a guide for tooth movement in PowerLiner. Convex button can achieve concise tooth movement from having smaller contact area with teeth than concave button. There are convex buttons of 3 and 4 mm diameter and 1 and 1.2 of height. Concave buttons have similar curvature degree compared to the surface of the teeth, which makes wide range of tooth movement easy. It has a cubic shape. There are 3, 4, and 5 mm width, 2 mm length, and 1 and 1.25 height. High elastic buttons are used for early treatment stages. Compared to the orthodontic wire, they are equivalent to resilient wires. Low elastic buttons are used in later stages of treatment. Compared to the orthodontic wire, they are equivalent to the stiff wire. This slide with the power button is showing the process how the tooth is moving into the blocked out space with the elasticity of the buttons. Depending on the location, the elasticity, the size, and the shape of the power button, the tooth movement patterns will vary. On a single tooth, 2 or 3 power buttons can be attached. Difference from traditional method. The conventional method manufactured its device by changing plastic materials into soft, medium, and hard. However, with the PowerLiner, dentists can simply replace the power buttons for a desired effect. PowerLiner can block out its model to the place where teeth are supposed to move, which makes a significant difference to the traditional way that makes setup model by separating teeth into supposed position. As shown in the figure, you can also complete the move by using a small, a medium, or a big button.